Mom, Dad, it is important that you know what signs and symptoms to watch out for to determine if your child has a UTI or a urinary tract infection. How do we know if your child has a UTI? Well, UTIs are common in kids. Bacteria may cause infection in any or all parts of the urinary tract. And if the affected part is the urethra, this is known as urethritis. If the affected part is the bladder, it is known as cystitis. And if the kidneys are affected, it is known as pyelonephritis. In this video, we will talk about common questions I get about UTI from the parents. We will also talk about the signs and symptoms of a urinary tract infection, how do doctors diagnose and how to treat a UTI, and ways that you can prevent your kid from getting a UTI. Hey, I'm Dr. Kristine Alba Kiat. I'm a board-certified pediatrician, and my mission is to empower you moms and dads so that you can raise happy and healthy kids. Urinary tract infection in children. UTI or urinary tract infection is common in infants and young kids. The statistics show that 3% of girls and 1% of boys can get a UTI by the age of 11. In a young child with high fever and no other symptoms, 1 out of 20 of kids will have a UTI. And UTI is more frequent in girls than in boys. And uncircumcised boys have a slightly higher chance of getting a UTI compared to circumcised boys. We have a child who is toilet trained, but the mom noticed that she is urinating often. She started wetting her bed after being dry for a long time. This child is also complaining of abdominal pain or belly pain. The mom notes that the urine smells bad, or there might be blood in her pee, and the child is complaining of pain when peeing. What is the possible cause? Well, it might be a UTI or urinary tract infection. What to do? Call your pediatrician right away. If there is bacterial infection, this needs to be treated. Let's go to the next scenario. Mom is asking, my baby's urine smells bad. Baby has a fever as well and is irritable. What might be the possible cause? Well, it might be a UTI. And what to do? Call your pediatrician. Your doctor would need to examine your baby and might do additional testing such as urinalysis and urine culture and prescribe antibiotics for your baby. What are the symptoms in kids that point to a possible urinary tract infection or UTI? These symptoms include fever, when there is pain or burning sensation during peeing, when there is a need to urinate more often, when the child has difficulty getting the urine out, when there is urgent need to go pee, or when the child who has been previously dry is now wetting his or her underwear or the beddings. If there is vomiting, the child is refusing to eat, when the child is complaining of abdominal pain or belly pain, when there is side or back pain as well, when there is a foul-smelling urine or a cloudy urine. Are you expecting a baby? Well, congrats, mom and dad. How much better life can be when, upon the arrival of your baby, you immediately feel confident about breastfeeding. And how do you get some rest? How to understand your baby's sleep schedule? Or when should you worry and call the doctor? How to soothe a crying fuzzy baby? Well, I've developed an online training video series known as the 5 Newborn Care Strategies. Do check that out in the description section. How do doctors diagnose a UTI in a child? Well, the doctor will ask for your child's symptoms, do a complete history and a physical examination on your child. And the doctor will request for a urinalysis to examine your child's urine and possibly send it for urine culture. Are imaging tests needed? Well, your doctor would Determine if your child would need an ultrasound of the urinary tract. These are especially done in younger kids, depending on your child's age, symptoms, and risk factors. How to treat UTI? Well, urinary tract infections are treated with antibiotics. The way the child receives the antibiotics depends on how severe your child's symptoms is or the type of UTI your child has. If the child has fever, is vomiting, and is not able to keep the liquids down, then antibiotics is given through the IV or intravenously into your child's bloodstream. And this treatment is done in the hospital. Otherwise, if your child is stable and can take food down okay, then the antibiotics is given by mouth in a liquid or pill form, and your child is treated at home. There is a need to treat the UTI right away to get rid of the infection, to prevent the spread of infection, and to reduce the chance of getting kidney damage. How to prevent your child from getting a UTI? Well, girls are particularly susceptible for getting a UTI because girls have a shorter urethra compared to boys. Therefore, the germs from the bowel can easily pass along going to the bladder. To reduce this risk, girls should always wipe from front to back. And there is also a popular home remedy where giving of cranberry or blueberry juice can be effective. Studies have shown that drinking these juices can make the urine more acidic and stop the bacteria from going. This is just as effective as drinking plenty of water. Are you worried then that your child might have a UTI? You should call the doctor if your child is not passing urine or has difficulty peeing, when you note blood in your child's urine, when there is swelling in your child's belly and your child is complaining of having difficulty in peeing, when there is pain while peeing, when your child is going to the bathroom to pee more frequently, when you note wetting during the day or nighttime wetting after a long dry period. Hey, if you like this video, watch my next video where I teach you about other child health problems.